Hello, Emilio.
How you doing, Judy?
I'm very well, thank you. I am with Emilio Leuzzi of the Dundas Denture Clinic, and I am Judy Chappella with the Loft Realty. And I have the pleasure of introducing people to Emilio, for those who have not yet met him. So if you would, Emilio, just tell us a little bit about your business. How long have you been in Dundas?
All right. So I taken over the practice in January of 2019 for my predecessor. Right now I'm entering my first year and a half of business. But this location itself has actually been around since mid-90s. It was originally a satellite office for a group of denturists with a hearing aid specialist. Then they sold off and got bought out by my predecessor in 2012.
Right.
And then I took over after him.
That being Kabir.
That we Kabir, that's right.
We both know Kabir. He's gone to Cambridge now, I think, hasn't he?
Yeah, so he bought a second location, gave me the opportunity to help him run during transition, and then he just ended up deciding to let go of Dundas and to stay in Cambridge and giving me the first right of refusal.
So you were working for Kabir as a new denturist yourself, is that right?
I was working between that, before I got a chance to work with Kabir, I was actually working as an associate denturist for another denturist in Hamilton for the last 4.5 years. So after I got out of denture school, I volunteered and I got a position right away. Okay. During that time, got a chance to learn more of the tricks of the trade and more invaluable, life experiences as someone that had over 30 years of experience. And then between that, also working out of 2 dental offices, one in Burlington and one in Guelph. So I wanted to develop my skills before I decided to go on my own.
Yeah, and it sounds like you had a lot of different experiences, which is always helpful.
Mm-hmm.
Very good. So just describe what you do, please.
All right, so I am a denturist. So basically, I'm a denture specialist that makes removable prosthetics. So in other words, I make smiles for a living. These type of dentures that I make, including full plates, partial plates, immediate smile makeovers for those that need to have full mouth extractions, and also implant dentures where I will coordinate my skills with dental specialists such as oral surgeons, dentists, and periodontists that will do the surgical parts, and I do the restoration of the removable prosthetics. So the patient gets best of both worlds.
Yeah. And how long does the process take?
Depending on the type of denture, typically it takes a couple of appointments, depending on how complex someone's treatment, because everyone is different. Every mouth is unique, so everyone's treatment, it's customized. So it can take between 3 to 4 appointments just for a standard denture. But those that are getting implant surgeries, then there's the time factor, because the surgeon has to place the implants. There's a healing phase, and I make the provisional denture in the meantime. Yeah. So then they kind of get used to the denture, but then when things are ready, then I activate those implants, and they'll seek gain the benefit of getting such a complicated treatment, but lifelong benefits with them.
Yeah, absolutely. Yeah. It must feel like a whole new person when it's all done.
Oh, absolutely. Especially when one's smile, is basically the most infectious gesture, because someone's missing a tooth, that's the first thing someone notices. So it has such a dramatic effect on someone's life and someone's ability to deal with people face to face, and they're conscious about how they look. They can actually do something about it. Sometimes dental treatment can be a little expensive for full cosmetic treatment, so dentures are usually the next best thing. They are prosthetic, so they're not teeth, but they're the closest thing, but they get an input on how they want their smile to be. Mm-hmm. So it's more customized. So they feel that way. Yeah. And going through a denture specialist, this is basically the best person to go than just getting the dentist to do the dentures. Because dentists, they're good at a lot of different aspects of dentistry, but dentures, it's a specialist. So it's a lot more involved. It's more complicated than just take an impression and then there you go. Here's your denture. No, there's a lot of factors involved because everyone's mouth is unique. It's very complex. So basically, it's building like a house. There's a lot of important steps involved.
So if somebody had something like gum disease, for example, they would get that dealt with first and then they would come to you, I assume.
Oh, absolutely. So if they have, a bad experience seeing a dentist when they're younger, they neglect, having routine care and having these preventive diseases or tooth decay could have been prevented. Then if they come to me and I see that their teeth are in rough shape, then I would have to refer to a dentist just to see if their teeth can be salvaged. But if it isn't, if it's terminal, then they would have to have the teeth removed, but they'll have the dentures made through me. So basically it's coordinated. So they'll have basically a set of dentures made while the teeth come out. So at least they have something to wear. So basically a Band-Aid with teeth. Yeah.
How did you get involved in dentures?
Originally, I actually have a cousin that's a dentist, so I, followed her footsteps. Shadowed her for a few years. I did co-op placement with a dentist, and I even did Doctors Without Borders, and actually got a chance to go to Nicaragua and actually provide dental care, and got a chance to see, firsthand, how the healthcare system is affected within impoverished communities and having the ability to provide dental care and see the impact. So for that, I wanted to, use my hands, but also, apply the sciences. So I pursued dentistry, try to get into dental school, but, just like medical school in Canada, it's very competitive. And so the options would be either go to the States, a little bit easier, but obviously it's far more expensive, or go overseas to the UK, a little bit easier to get in, but the chances of getting back into Canada require additional training, more time, more money. So I didn't want to be in school for such a long period of time. So instead, I kind of fell into a profession that, that's like a dentist, but gives you the ability to do work with your hands, be your own boss. And so I found this field, and I actually love it.
That's awesome. I didn't know that, Emilio. I can imagine going to a place like Nicaragua and seeing the difference that you can make to people's lives. You think, well, I can do that anywhere, and including Canada. And that's a wonderful story. Fantastic. Where did you go to school?
Yeah, and before I went to denture school, actually, I did my undergrad at U of T. University of Toronto, the Mississauga campus. So I did that prior, pursuing dental school. But instead of going into dentistry, I went to George Brown College in the waterfront campus, where they have the denture program. So it's a 3-year intense denture program that basically gives you the proper skills to make dentures, not and see patients like a dentist, but also do the technical side, which basically where the majority of my field we do a lot of the magic behind the scenes, like a technician. So it's a good mishmash.
Yeah. There's a lot to it, isn't there?
Oh, absolutely. There's a lot of technical side, but also a clinical side. So there's a lot of factors that go in designing a denture.
Yeah. And do you do any form of a house call at all?
I do. So I'm one of the few in the area that actually offers house calls, because my niche is a lot of seniors that I treat. So not everyone has the ability to come out and drive to my office. So some people are bedridden, some people have mobility issues. So sometimes it's just easier for me to bring the clinic to their private residence or in a nursing home, and sometimes even in a hospital. So I do house calls, and the family appreciates that, because it's a lot of time and energy just to coordinate and having wheel-trans and bring them to my office, and sometimes it just takes a lot out of them.
That's wonderful, Emilio. I like that. That's lovely. And how are you working now? Like, how has the pandemic affected your business? I mean, it's obviously affected it significantly.
Yeah. So because I deal with such a vulnerable population, and like most healthcare professionals, we had to shut down our offices temporarily. For us in Ontario, we were able to see clients on an emergency basis. So basically, if anyone had dentures that were hurting them to the point where they couldn't tolerate it with over-the-counter medication or saltwater rinses, then we would open up and see them. But of course, taking all the precautions with all the PPE and screenings done just to make sure we protect ourselves and them. Or if they break their dentures, then they just drop it off without even having to come into the office.
Mm-hmm.
But as of May 26th, the Ministry of Health has allowed all healthcare professionals to actually open up their office. So instead of being in an emergency basis, now we can, phase opening to general treatment. So we can resume regular treatment.
Right.
But of course, there's more restrictions happening with seeing clients. So there's more screening, more precautions. Just like dentists and denturists or hygiene, we've already done a lot of the same PPE protection where we have the clinical coats, we have the masks and gloves, and we're always spraying down the rooms between patients. But now we just take a few additional precautions with pre-screening over the phone, taking temperatures. But right now I'm just limiting who comes into the office instead of having the door open for walk-ins, which is one of the nice characteristics of Dundas, where people just come on in anytime without making appointments. Now I just lock the door and they have to call in, and we just restrict having one patient in the office at one time just to minimize any potential for interaction.
Yeah, a lot of sort of common sense approaches as well. And I know you're right next to the Dundas Animal Hospital and across from the old post office, right? What's your address there, Emilio?
It's 113 King Street West in downtown Dundas.
And how do you find having your own business? What's that like for you?
From working under someone and actually running my own business, it's definitely a good experience. I actually love being my own boss. I love having the ability to build and grow my own practice. Yeah. It's one of the best decisions I have made, rather than just keep working under someone like this. There's a security of always having an income, but you're always working under someone. Someone's always giving you direction, and there's always a glass ceiling to hit. So at least with opening up your own practice, the sky's the limit, basically.
Fantastic. Yeah, that's awesome and really good for you. What would you say what your biggest challenge is about opening, like having your own business?
I would say initially it's, I'm lucky that the practice that I bought, it wasn't previously established. So there's already established reputation, established clients already been seen, and it's already ingrained in the community. So taking over has its own challenges because my predecessor, has been around for about 7 years. So a lot of people got used to him. So as being a new guy in the area, it takes time for my reputation to get around. I had an opportunity at least to transition and people get to know me before, the transition was complete, rather than just going in blindly and not knowing what the practice is like or what's the area like. Yeah. Compared to if someone had to start from the very beginning where, building up from the ground up, building up the clients, that will be the biggest challenge.
Yeah. Oh, yeah. And we both know Kabir. He was such a nice guy. And I think as you say, he probably laid a good foundation for you.
Oh,
and
absolutely.
You've also taken his place in Rotary as well, which is great. How are you enjoying Rotary?
I enjoy it. I enjoy, the whole prospect of, serving, above self. So I like to help people, like to be part of the community and actually help the community because, Dundas is a small town and it has that mentality where they support and help local business. So the business needs to help and support the community. It's that kind of symbiotic relationship.
And your profession is a helping kind of profession, really. I mean, you're doing needed work, but it's also emotionally has to be quite challenging for people sometimes. And as you say, you have to sort of work with people in that capacity as well.
Oh, absolutely. It's it's a bigger spectrum. Like when everyone that thinks of dentures, they think of seniors, but in reality, it's actually more broad spectrum. Sometimes people, at a very young age, could develop, gum disease that's just due to familial genetics, or could be due to abuse, or it could be due to even an accident, and they don't have the means to get proper reconstruction through the traditional dental care, cosmetic reconstruction. So alternatively, being able to at least give them back some form of function, makes a big impact. And when they actually get good dentures made, they get very emotional.
Yeah, absolutely. I can imagine they would. It's life-changing, isn't it, really?
It can be.
Yeah. And you just were married recently. How long has it been now?
It has been, I would say, entering 7 months now.
Good for you. Congratulations. It's a big wedding, wasn't it? I understand.
It was a very big wedding. It's half Italian, half Greek wedding, so it was very large, but everyone enjoyed themselves.
Oh, I bet it was fantastic. You speak Italian?
I speak a little bit. I have a bit of a working proficiency, but I'm not fluent, unfortunately. Right. It's one of the things that I do regret is not, pushing myself to be more fluent. But I'm getting there.
It's never too late, and you just keep working at it, I guess. But
exactly.
Anything else you'd like to share, Emilio?
No, that's about it. Everyone just needs to be, be safe, be healthy, with this new norm. It's unfortunately has changed the way we, interact and do business, but as long as everyone follows the rules, we'll kind of get back into the norm.
Well, we are resilient and we are adaptive, and we will get used to whatever does become the new norm. We just will. That's just the way we are, isn't it? Mm. So thank you so very much, Amelia. That was a real pleasure talking to you, and I certainly learned more about you than because I've known you for a couple of years now as well. So wonderful. Thank you so much, Emilio.
No problem. Thank you.
I'm going to put your contact information up after the video, just so that you know.
Perfect. Thank you very much.
Bye for now.
Take care.
Okay. Bye-bye.